The following care instructions must be followed for the next 2 to 3 weeks while your permanent veneers are created in a dental lab. It is strongly advised to take your prescribed medicine as directed to reduce inflammation and keep you comfortable. Since the temporary veneer has yet to bond with the underlying prepared tooth and crown, the tooth itself may be more sensitive than usual. As such, it is important to avoid extreme temperatures, heavy chewing, and sweets like hard candy. It's also important that you refrain from biting with your temporary veneers. Instead, it's encouraged to cut your food into bite-sized pieces while chewing with your back teeth. When brushing your temporary veneers, use a gentle motion and refrain from flossing in between them to avoid accidentally pulling them off. In the event that the temporary veneers do come off, contact your dental office immediately to replace or reseat the temporary veneers. If you're unable to visit the dentist right away, temporarily put the veneer back in place with an over-the-counter denture adhesive or Vaseline, and visit the dentist at your earliest convenience.